Sometimes a heart transplant is not an option for patients with advanced heart failure. Still, individuals need something to keep their heart pumping. A left ventricular assist device, LVAD, is an alternative device and often people's only option. An LVAD is a surgically implanted, battery-operated mechanical pump that assists a weakened heart's left ventricle in pumping blood to the body. Dr. Hernandez, cardiologist and medical director of the Advanced Heart Failure Program at Monument Health Heart and Vascular Institute, shares more about the device during one of February's Heart Month's Doc Talk.
So basically, the surgeon will put this small pump in the tip of the heart, as you can see here. So the pump will pull blood from the inside the heart, and it has a small, you see this tube that will push the blood into the aorta.
One of Dr. Hernandez's patients lives with an LVAD. He joined the conversation for a little show and tell.
So we have a controller. The controller has two lines here because you have two battery packs, right? So people will live, with two batteries on the side, okay? So, and they can be at home.
There are a few limitations and safety precautions an LVAD recipient must take.
There's things that you can do and there's things that you cannot do with an LVAD. Albert, do you want to share what things you cannot do?
No getting wet.
Yeah, you cannot swim.
Yeah, or shower, you gotta put a window on.
You cannot shower normally. That is true. You have to cover the area because you don't want it to get infected. You cannot get into a pool or a tub, because you cannot go with an electrician thing, something electric into the water. I think we know that.
Yeah.
There are two ways the LVAD can be implanted, with an open heart surgery or through the side with a minimally invasive thoracotomy. LVAD batteries last about 12 hours. Depleted batteries increase the risk of stroke because the machine could slow or stop. If blood doesn't move, it clots.
Let's say that you travel, this is an example. Let's say you are from Wyoming and then you travel to Rapid and then, it's a trip, I'm gonna be back in 2 hours, 3 hours. And then there's a big blizzard. And then what happened? Gladly we would have snow neither, So I always remember you had to, carry your batteries and your charger.
It's typical for LVAD patients to lack a strong pulse, but LVAD creates a pulse for them.
You cannot really hear the heart sounds, so you just hear what we call a hum. So we call it an LVAD hum. You hear a hum.
Checking blood pressure is also done in a non-traditional way.
So the way you take the blood pressure is you put a cuff, as you mentioned, with the Doppler. You can hear like the arterial, it's kind of like the pulses, I guess. It's easy to explain. So the waveform, you hear like, ooh.
That Doppler, they put some goop on you and then it makes a swisher noise when they hit it on where your pulse is.
Even with advanced heart disease, the LVAD helps patients add more years to their lives.
Yes, I know it's not the easiest thing, right? No. As you mentioned, you cannot shower and there's a lot of things that you're limited, but you should be able to do as much as you want.